All right, we are back to answer some Reddit questions in the back pain Reddit group. I'm with Andrew, who's out of Sydney. And Andrew, do you just want to tell me a little bit about how your day went? Because it's way past your bedtime.
Yeah, I'm just finishing up. So I think I actually bumped into that thing with well, I bumped into some new information. So I showed it to Andy and I was just like showing different clinical pathways of like what happens in Australia, I guess. So yeah, it was pretty interesting little watch there for I guess whatever I was doing today.
The clinical pathways that we're going to talk about today.
Yeah,
Okay, cool.
that's a cool nugget that I kind of compiled.
Okay, so I have sent that link over to the group, or the actual comment that we're going to be going over today. Um, so essentially, we picked a question, started to go through it, and while nothing specific about what we're going to talk about today is considered medical advice, so anything that really sparks your kind of thought process about your own back pain situation, like always go get that checked out with a medical provider, and or like a movement specialist, like in person, who can walk you through these ideas. So every case is different, and we just want to make sure that you guys understand. We might break down a couple things about how we would deal with this person like in person, but always take note that we're not suggesting any procedure or medication or surgery or anything like that. So and as Andrew pointed out, a lot of medical advice is collaborative, so it always should include the other person in a one-on-one setting as well. So I'm going to go ahead and share the screen for this question and see if I can zoom in. But essentially, the just to break down this question, um, like just a quick highlight. This person was seemingly they've posted about how very healthy that they are prior to their back pain experience. So they're eating 1 to 2 portions of fresh fruit. They keep processed food to a minimum, sleeping 8 hours, biking everywhere, going to the gym, hitting 10,000 steps. So just like from the outset, looking very, very healthy and active. Started to have some back pain issues and some stomach issues, which maybe bothered them, it concerned them. So they went and got that checked out by a GI doc, and they found that there was nothing really wrong. And then saw another doctor and fixed the digestion issues. So interesting history so far. A little bit of digestion and back pain, but that seems to have been checked out. Then they found a physical therapist, and this is where Andrew and I were kind of talking a little bit of confused on what this person meant. Is essentially saying, I went to a PT and they had said that the stomach issues were creating some type of feedback to their muscle being tense up and involving their sciatica. So, but Andrew, before I ask you your opinion on this, I'll just mention that patients and people, sometimes when we explain or educate, I've had patients that I've explained something and then they come back and re-explain it to me. It's not quite what I meant. So we have limited information here, but just from what this person has written, it's a little suspicious. I don't know what they mean by this or what somebody was trying to tell them in regards to their problem. So Andrew, what's your first gut reaction to hearing about a feedback loop and a stomach issue causing sciatica?
Yeah, I don't think I've seen anything specifically for like a case like this before. So maybe the therapist might be like, "Hey, you having like back issues already and stomach issues together might be some connection there to the sciatica," but it's like not really sure what's happening
Yeah,
there.
I mean, just at least like physiologically, I can't picture the connection. Just, I mean, I know that more serious, red flags like cancer and tumors and pain can present as referred pain. Stress can mess up the GI system. So it just feels like a stretch to me, I guess, is kind of my point
Yeah,
where
it's hard to say like with confidence that these two things are directly connected with like without the rest of the information. It's like if the person's more stressed and like if they're really stressed, they might also have like gastrointestinal issues, right? It's like, hey, I can't really eat right now. I'm like super stressed in my life about work, about kids, or whatever. It's like not too sure
Hmm.
about what it could be, and
Yeah.
it's
So,
just like, yeah,
yeah, and yeah, I don't know how what to really else mention about it other than that sometimes practitioners can make inferences and leaps, and they're not quite really. I mean, they sound. I mean, like if you're a young clinician or you've been practicing, or maybe you're an older clinician and you want to give somebody an explanation, sometimes it's hard to say, I don't really know what's going on, and then just kind of treating what's being presented with. So that's the other thing I can think of is maybe they just want to give somebody an answer sort of thing. So, um, anyhow, the good news is they decided to go to a different PT. A new doctor took some x-rays and showed that they had a deviated disc, had an epidural, and then 2 more months of PT. Still doesn't feel like the issue was addressed. Andrew and I were talking about x-rays showing deviated disc. MRIs are the gold standard for showing the actual disc health and the nerves of the spinal cord and everything. So MRIs you can sort of look at, especially if you have a before and after with some time. X-rays can show a little bit of disc height loss. Not sure there's like the perfect imaging strategy for determining if somebody's had a deviated disc, which I'm assuming a deviated disc is like a herniated disc. Is
yeah.
that
I
what?
assumed it was a herniated one as well.
Yeah. Um, so that being said, here's where we kind of get into a little bit of what we want to present on today. Is this person has gone through the medical system? They've seen several doctors, several PTs, and now they have told us that they're avoiding back activity, like any back activity, and they keep going to PT. And one day, a light backpack, and they go from a 2 out of 10 pain to a 9. So something about wearing this backpack, which I'll mention actually at the beginning, the patient or this person didn't really mention an acute injury. It just said one day I started having back
Out
and
of nowhere.
yeah. So that is a good sign to me. This if somebody is not like, hey, I fell and now my back hurts. Instead, they're like, I just woke up and it just hurts all of a sudden. Especially as a young 28-year-old, these are all pointing to a good prognosis. So, in general, when I hear these things,
Yeah,
good
it's just like they
prognosis.
were just wearing a lightweight backpack, and then their back went.
Yeah. So if you go like 5 months without doing any back activities, your physical therapy maybe isn't demanding enough to sort of match or exceed the demands of your life. You're gonna lose out. You're gonna lose some conditioning. You're gonna be deconditioned potentially. And the interesting thing is when you have a flare up from something like a lightweight backpack, you also have to consider like how much sleep have we got in the last few days. What has our overall activity been like? What has our stress been like? What are some things that you would kind of bring to your attention, Andrew, when you're educating and someone's telling you these things?
Yeah, I think it's like I try and mainly it's less so asking about questions, like specific questions, more so like trying to get the full picture or the full story of what happened, right? So it's like, and then I kind of tail out um from what they've mentioned in their story. So I think for them, the biggest thing would be like, hey, I've this is me making a few assumptions and guesses from what they've mentioned so far, but it might be like, hey, from my story so far, this is what happened. So
Hmm.
my back kind of just flared up and I'm super stressed because it feels like nothing's really helping and had the whole gastro issue as well. So it's like, is everything connected? So that means I'm like even more anxious about what's actually happening. And now I've been told that I have a deviated disc from my x-rays. And like I was and apparently my physical therapist said there's something wrong with my posture as well. It's like what is happening, right? There's like so many little things that are like adding up to feeling even more stressed and anxious about the health of my back right now or this person's back.
Yeah. No, those are all excellent points.
And then
The
one day
Go
it's
ahead.
like suddenly then they chuck on the backpack and this is the straw that broke the camel's back because like on all the stress now everything's just exploding.
Yeah, and not to like make light of it, but like I've had back pain before, and it's usually the pillow that you pick up off the floor that is like, oh, I think I ran like a 5K untrained one year, and it was like for a Parkinson's Foundation, and it's like you get to I haven't been training, right? So we talk about a lot people doing too much too soon, leading to all kinds of issues. Well, for me, I was probably around 28, and I was like, I can run a 5K, like whatever. And the next day I'm like super sore, obviously, and I'm just putting groceries away into my I like these moments where you hurt your back is like they're kind of ingrained in you. But I was like literally putting away groceries into the refrigerator, and like my back locked up, and I ended up like on the floor. So it's like, should groceries be the thing that just like destroys your back? Well, no. I mean, we just have like a cumulative effect of all these other issues and factors.
Yeah. I think if for the audience, if they're super interested, they can look into reading like allostasis or
Hmm.
allostatic loading.
Hmm.
So that's like, I guess, the
Yes.
theory that we're talking about.
Yeah. Yeah. If you just literally go and Google type in allostatic load, ALLO static, you'll kind of read about what sounds like an equilibrium or just like a perfect balance, but really what it's attributing, I think, to is like all these different factors that can ebb and flow in regard to stress levels, right? Um, is there something else you want to add about my definition of allostasis?
Yeah. No, I think that's pretty good.
Okay, cool. So the person then decided to go to the hospital, got diagnosed with degenerative disc disease. So 6 month anniversary. So they've 6 months down the road. Now they've got a diagnosis, which the probability of having degenerative disc disease at 28 is around 30 to 40%. That's in asymptomatic individuals, which we've talked about in previous lives. So she could have had, or he could have had this degenerative disc disease diagnosis and not even know it. And so it's not, I come back to this idea about prognosis. So not necessarily a death sentence. And they're in this, like they mentioned at the beginning, denial, bit depressed. And they feel like that everything they've been working for and staying healthy is kind of going down the drain. So it seems like their question is more about coping. And we just want to talk and highlight what it kind of feels like or looks like to have different clinical pathways that people experience, which can lead to differing outcomes. So, Andrew, I'm going to just switch here and we're going to scroll to the top. And just quickly, do you want to just run through each of these, or do you want to run through like the one that this person's probably experiencing?
I think just for time's sake, we'll go to Tragic Pathway 1A. But I think next time we can run through the whole thing as well.
Cool. Okay. Um, okay. So in general, like the image that you're seeing is like there's a patient going to a general practitioner, and then there's different basically pathways that people experience. And Andrew, I'll let you kind of, since you brought these up, run through it if you want.
Yeah, so I guess it's like typical stories or pathways that a patient would go through when trying to enter the medical system and like seek help, right? So it's just like what does a patient journey look like when they're receiving good care and when they're receiving not so good care in this case?
Hmm.
Yeah.
So the patient goes to a general practitioner. Then what happens? They've got back pain. What happens?
Yeah, a lot of the time, GPs are like the patient's really scared. They're like, I really want to know what's happening to my back. And the GP's like, oh, all right, let's go get a scan done to see what happens. And in this case, they got an x ray done. It's like, oh, okay, we've got a herniated or deviated disc here. Um, I think what I should do is that generally lots of people are sent to like a specialist or spinal clinic. And then they're like, okay, I'll be sent away. And then after that, if they're generally at the spinal clinic, they're like, okay, let's dive in a little bit deeper and like ask a person to see if there's any red flags or whatever. And if there isn't, it's like, okay, you don't have any red flags of like um, loss of leg strength or power, or and your bowel control is fine, and you didn't fall over or anything, and there's like no trauma and there's like no infection or fever. It's like, okay, nothing's urgent. probably just send you back away, and later on we'll see if you need to get surgery or whatnot. And then you're just waiting for something to happen before
Yeah,
you see like a surgeon or whatever.
yeah, and I think this is where people get I think this is where people get a little frustrated because in the States, there's a lot of waiting because, um, if it's not urgent, then it's like, hey, we can wait a little bit and go more towards that conservative management approach. And essentially, this is where it's like if you're not getting answers, which you don't necessarily always need a specific diagnosis to feel better. I think a lot of times people say, well, um, if I don't have a specific diagnosis, how do we know the treatment that we're doing is most appropriate or the right right direction? And that's where it just comes back to that unique individualized approach. It's like different pain presentations sound like different things, so it's a little bit easier to go in a direction when you're trying things in clinic. So physical therapy and physio and exercise physiology, uh, the art of it is essentially determining what's kind of their goal and then working in the moment to pick a direction based on how somebody responds. So exercise is often like a dose, right? So there's a dosage that someone can tolerate or not tolerate, and then you kind of go from there. So the waiting game, if you're not careful, can lead to a lot of maybe deconditioning, which is what it sounds like after 6 months of kind of spiraling, this person is experiencing.
Yeah. So this is what I think is happening. It's like maybe they're lacking a little bit of education, or somebody didn't tell them what other pathways that they could try out. It's like, was this person told on what conservative therapies are there, or what they should do
Hmm.
in the meantime? And if nothing's told, or nothing is been presented to them on what to do in the meantime, then lots of people actually do just sit around or lay in bed all day and try not to do anything because they
Hmm.
think doing something is going to make it worse.
Yeah. So if we um, come back to this person's story, um, they're asking about coping, and the thing that I would kind of hang on to is prognosis, right? So he's like, there's a difference between, and I mentioned it a little bit earlier, is getting a diagnosis and getting a prognosis. When we talk about degenerative disc disease, you know, those are like wrinkles on the skin. It's like as we age, and that chart that you presented from that study about um, asymptomatic individuals breaks down the probability of people having these certain conditions as they age into each decade. And so there's a probability that most people are walking around with these normal degenerative changes on imaging but are completely asymptomatic. So you can use, maybe that information to say, well, maybe my symptoms, maybe they're not coming from degenerative disc disease. And this person didn't even really mention symptoms, which if you're listening and you're posting on Reddit, it's super helpful if you include what symptoms you're having.
Yeah, because most of the time, like as special as like I guess exercise therapists or movement therapists, it's like we mainly go off symptoms and we try and see and explore what things are aggravating and what things are helpful.
Mhm.
And that's all done through your own like aggravations or whatever. It's like these are your symptoms. We can't predict it by just reading a radiology report.
Mhm. The other thing is there is this not I mean I'm kind of sensing hopelessness, right? So um, anywhere I read, every time I research, it says I'm forever screwed up.
Yeah, it's super scary. Especially if I think there's like a crazy thing about like when you are researching stuff as well. It's like if you specifically type something into the Google search bar, you're probably gonna find it. It's like, is my back gonna be um will it get worse or something or whatever? And then it just shows things, situations where it does get worse
Hmm.
compared to looking for the opposite. It's like, oh, when won't my back get worse and stuff, which people
Hmm.
don't really do.
Yeah, I mean, if I just let's just for fun, let's just say Google.
So it's like,
What is the prognosis? Hope this doesn't backfire. prognosis.
think it's more along the lines of like, I guess, quote unquote, it's not really confirmation bias, but it's like looking for something specifically, and then you
Mhm.
end up finding that specific thing you're looking for.
Right.
And if you're
So
really scared and you're thinking about things negatively, then you kind of just type up a sentence or a question that might be already
yeah,
biased in one way or another.
yeah. This is where this is. I was hoping. My bias is just as we've been talking about. Is like you're going to Google degenerative disc disease, and I would think immediately the prognosis. There's going to be information about prognosis, but all these are talking about basically. Well, here we go. This is the actual study that we were talking about, isn't it? Where if we come
Can't
down
remember who
to
the exact authors are. Oh, it's a Bajirkinji or something. I can't say that. Brijinki? Jiki? GTT?
keep going,
I'm not
try
sure.
again. This is the prevalence of lumbar disc degeneration in symptomatic younger patients. Okay, well, I went a little too fast. So this wasn't exactly what I was hoping for. And this is to your point. Look, all these resources are missing the word prognosis.
Yeah. It's like,
Um,
yeah, I think when you do research, it gets way harder because it's not even like it's not that there is a lack of information, it's just that there's information overload. There's just way too much information to sift through.
mhm. Without even really digging, prognosis is quite favorable. High prevalence of disc degeneration in asymptomatic subjects, 15 to 30. Prognosis and quality of life. I'm sure that it's going to continue to say that it's quite good. And it's kind of going back to, I don't want to harp on this over and over again for too long, but it just is going back to the idea that there's such a high prevalence of, you know, the aging process of the spine includes herniated disc. People don't like to talk about this. Herniated disc, there's something like, I think it's between like 6 and 9% of all like herniated discs are coming from lifting heavy. So there's all these factors like genetics and other lifestyle and social factors and things like that will play into somebody having these herniated discs and whatnot. So all in all, pretty good prognosis for this person. I think their biggest concern is I've been through this gamut of healthcare. They're trying to help me find my issue. They found a couple diagnoses, but the advice that I would give somebody in this situation is, instead of thinking about 6 months ago how I could do all these things because I was all healthy, you're kind of at a new baseline. And so you kind of have to, instead of thinking like, oh, I'm gonna, and just like any type of habit, you can't start out too strong or going too hard or too frequently. So if there are movements that you find comfortable, I would do those. If walking feels good, focus on being able to do that, and you'll feel like there's a little bit more in your control. Andrew?
Yeah, I think what's also missing is sometimes from like the medical practitioners, like what do these actual reports mean, or like how important is this thing? Like if degenerative disc disease, it's like, okay, I'm 30 years old. It's like, what's the chance that people even get that in the first place, right? By the
Mm-hmm.
time you're 30, it's like 50% chance. So that's a coin toss.
Yeah, I
One
was
in
I was
two people will have degenerative disc disease by the time they're 30.
yeah, and then the key point, it's it could be asymptomatic, like,
Yeah.
and it's like if you scan 100 people at Walmart or whatever, like 99%, 99 of them are going to have some type of degenerative changes of the spine. So it's really that, I think, that having that knowledge and reassurance should be hopefully helpful with, in this case, for this particular person. Um, and other than that, without knowing or working with somebody one-on-one, it's really hard to be like, this particular stretch or this particular movement. They, you could have the degenerative disc disease kind of diagnosis right now. It might not even be the thing that's causing your pain. So it's really hard to say, hey, don't do XYZ or anything like that. I will say, there is something called a fear pain cycle, or like avoidance behavior cycle. So you've mentioned avoiding any back activity. Maybe it's just a matter of finding the right back activity that you can tolerate right now with the appropriate guidance of somebody who can tell you, hey, this is the right amount of acceptable pain that you should be experiencing, and this is okay.
Yeah, it's like finding out if it's sore but safe, I guess.
Yeah. So orbit safe is a good. So if there are follow up questions to this, particular question, I've linked the live to the actual Reddit question. So Andrew and I are going to be going live as of right now every Monday, sometime between 8 and 9 Eastern, and we are trying to just expose more people to best and better practices than what's out there for back pain. I think one of the more frustrating thing is, for this particular person, and a lot of people I hear is, oh, I have this problem, and my aunt said epidural injections were the like life-saving procedure for her. So then this person goes and gets epidural injections, and maybe it was, if you look at the research, it might be a coin toss. And then it's like hard for people to grasp how their condition might not present or behave like somebody else's. And the truth is, everybody's is a little bit different. So it's kind of frustrating to hear chiropractor helped and then doesn't help, or physical therapy helped, or exercise physiology helped, and then it doesn't. So have hope, I think, is a kind of what our goal is with coming on here and trying to educate and inform people.
Yeah, I think it's have hope and like continue learning and like looking for high quality sources. And that's probably like the hardest thing to do. It's like, how do I get to like these high quality sources? And I guess that's what Andy and I are trying to distribute to like the general public there.
Yeah, and the last thing I think I would leave, if anybody that's getting any type of treatment for musculoskeletal condition, if you don't feel like you're progressing within a certain amount of time, just take a step back and think about, okay, the treatments and things that I'm getting from a physio or a chiro, um, how are they helping me, A, get back to my goal, but B, are they like, are the interventions a high enough demand that match my lifestyle? So we find people complain about physio experiences where they're laying on the table for every treatment. They get ice and heat and other treatments that are not necessarily bad, but maybe in conjunction to other things would be more beneficial. So, Andrew, do you have a quick tidbit about anything like that?
I guess it's like advocating for more proactive therapies. Like look for people who are interested in like saying, hey, if you're interested in riding your bike again because you're riding for multiple hours or whatever, it's like, okay, let's try and get back to that point in time. And if your practitioner doesn't have that as like front of mind, like this person wants to get onto their bike again, then it's like, okay, maybe this isn't the right fit for me.
Hmm.
Yeah,
Um, I think, I mean, I like to keep these at a half hour, just a quick looking at the clinical pathways again, real quick. The smiling assassin is what we're referring to. So, um, as Andrew was pointing out, the patient goes to the GP. If you have a general practitioner who's listening to your history and your symptoms, and they're not suggesting a scan, that's not inherently a bad thing. I think patients and clients and things like that, people who have back pain, they want an answer, but the evidence right now doesn't necessarily always suggest somebody should run out and get a scan, especially within that first 6 weeks.
yeah.
So if the
Unless
GP,
there are red flag symptoms,
yeah,
which the GP should be asking you about.
yep. And then so you go to a physio, and the physio then is focusing maybe on the bio mechanical reasons why you might have pain, or like a very specific diagnosis. So you have a general practitioner who says, hey, let's go try conservative management. Physio says, I'm glad you're here. And they're basically trying to target like a very specific structure. But Andrew, how did you explain it earlier?
Yeah, maybe they only look for um, a structure that needs to be, I guess, massaged or loosened up or something, and they only focus on that. And it's like they can fix you. It's like this person is here to fix you, and you're not in control of trying to improve your life. So I think at the very bottom of this whole thing, um, there's a what's next section. I think that kind of summarizes what we're trying to move towards there.
Mm-hmm.
So it's like shifting the model of care away from pathological detection and quote unquote correction. And now it's like, okay, let's screen for things that are dangerous and emergency situations. And then it's like, how do we get this person to doing what they want to do in life again?
Yeah, I think it's not always easy because you have competing narratives, and so that's, I think, what we're trying to push is narratives that make sense, that are not outdated, and that are actually going to keep you from being fragile. So coming back to our Reddit case here, is that this person, because of their experience and what they've been told, and we see this a lot, is they start to avoid certain activities and they become more fragile. And like wearing a backpack that apparently is very light shouldn't be enough to damage your back. Like it really shouldn't. And pain and damage don't always mean the same thing. So you can have high amounts of pain and almost no damage, which is a whole nother conversation.
Yeah.
But
Yeah. So in this case, it might be that there might not be much or any damage in quotations, and it might just be like because you're really deconditioned and you're in a super stressed state, it's like anything that touches you makes you extremely sensitive to like feeling sensations in that area. And in this case, it's pain as a sensation.
so hopefully this was helpful. Other people that see this, if you have other questions, like we're constantly checking Reddit and things like that. And if other clinicians want to get on board and kind of chat with us about how they can help and contribute, like we're open to that too. So other than that, that's all I've got, Andrew.
Yep. All right. Thanks, guys.
All right.